Recording in progress. Cek. Dek, sebelum kita mulai, pembicaranya sudah ada di sebelah. Bagi yang ingin mengumpulkan kartu kuning, tolong dikumpulkan ke satu orang, nanti diserahkan ke kami, ya. Terima kasih.
Assalamualaikum warahmatullahi wabarakatuh. Good morning everyone and welcome to the World's Top 100 University Guest Lecture. The Honorable Vice Dean of the School of Veterinary Medicine and Biomedical Science, Dr. Andrianto, Magister of Science. Welcome, Doctor. The Honorable, our guest lecturer, Dr. Gabriel Mas. Please welcome. The Honorable Representative of Farmwell, Mr. Bruce McConnell. Please welcome, sir. The Honorable Representative of Farmwell, Mrs. Jess Calcutt. Welcome. The Honorable Representative of Animals Australia, Dr. Jennifer Hood. Welcome. The Honorable President of Synthesia Animalia Indonesia, Mr. Giovanni Manuel Calvari. The Honorable Representative of Synthesia Animalia Indonesia, Dr. Deborah Bianti. Welcome, Doctor. The Honorable Representative of Synthesia Animalia Indonesia, Dr. Sasa Fernandez. Welcome, Doctor. The Honorable Representative of Indonesian Veterinary Medical Association, Dr. Sinta Rizanti. Welcome, Doctor. And all of the beloved students and staff of the School of Veterinary Medicine and Biomedical Science. My name is Akila Sabita and I am honored to be your Master of Ceremony for today's agenda. First, let us thank the Almighty Allah Subhanahu wa Ta'ala. Because of His blessing, we are able to gather here today without any obstacle. Praise and salutation upon our Prophet Muhammad Sallallahu Alaihi Wasallam, who had brought us to the path of light from the darkness in this life. Ladies and gentlemen, we gather here today to learn the complex and compassionate aspects of veterinary medicine, focusing on the critical areas of anesthesia, analgesia, quality of life, and euthanasia. Throughout this lecture, we have the privilege of hearing from a distinguished expert in the field who will share her knowledge, expertise, and insights. It will be presented by the Honorable Dr. Gabriel Mas from the Veterinary of Western Australia. This lecture aims to help us understand and improve our knowledge regarding animal welfare. Our next agenda is singing the national anthem Indonesia Raya and hymn IPB. Ladies and gentlemen, I would like to ask you to please stand up. Ladies and gentlemen, please have a seat. Before we begin this lecture, let us take a moment to come together in prayer according to our personal religions and belief. Prayer begin. Amin, amin, ya Rabbal Alamin. Move on to the next agenda. We have some welcoming speeches. The first speech will be delivered by our Vice Dean of the School of Veterinary Medicine and Biomedical Science, Dr. Andrianto, MSc. For Dr. Andrianto, the time is yours.
Terima kasih. Assalamualaikum warahmatullahi wabarakatuh. Supaya semangat kalau saya bilang SKHB berjaya, IPB Dikdaya, jaya, jaya, jaya ya. Ye gitu ya. Biar semuanya semangat. Oke. SKHB berjaya, IPB Dikdaya, jaya, jaya, jaya. Oke, kita ulangi sekali lagi ya. SKHB berjaya, IPB Dikdaya, jaya, jaya, jaya. Have you had a breakfast in this morning? Belum ya. Oke, jadi alhamdulillah pagi ini kita bertemu dalam keadaan sehat walafiat. I would like to thanks for delegation from Synthesia Animalia. Oke, tepuk tangan buat Synthesia Animalia dan ini ya. Jadi beliau tadi sudah belajar bahasa Indonesia, ya. Bahasa yang langsung terlintas di beliau-beliau yang dari Australia ini, kepalaku pusing katanya, ya. Yang satunya bilang satu kepala satu kelapa. Kepala is head, kelapa is coconut. I hope in the next time if you visit again our university harus sudah bisa bahasa Indonesia, ya. Okay, in our university first I want to introduce. The first we have the regular student, and the second we also have the international student from Malaysia. Oke, tepuk tangan buat internasional dan reguler ya. Oke, the first distinguished speaker Dr. Gaby Mas, and the distinguished guest from Farmwell Mr. Bruce McConnell. NIB in Indonesian Veterinary Medical Association, Ibu Sinta, dan all of the audience, good morning. First of all, I would like to welcome you to our campus, IPB University in School of Veterinary Medicine and Biomedical Sciences. I, as the Vice Dean of Research, Development and Collaboration, we highly appreciate the collaboration between our school and Synthesia Animalia. Tepuk tangan ya. And the Animal Australian and Farmwell. Tepuk tangan juga buat Farmwell ya. So that the seminar entitled Veterinary Anaesthesia Analgesia, Quality of Life and Euthanasia could be successful carried out in this morning. Ini materi yang sangat penting ya di farmakologi. Jadi harus nggak ada ujian, tenang saja ya, aman. I believe the topic of the seminar that will be presented today is very interesting and also important, especially for students and obviously for us as veterinarian, especially how to use the anesthesia and analgesia properly and correctly so that it is included in the corridor of the animal welfare. Jadi Sintesa Animalia ini sangat concern dengan animal welfare. Nah, kita berharap nanti pengetahuan ini bisa di-share ke kita, termasuk penggunaan anestesia. Furthermore, today's seminar activity is one of the performance achievement evaluated by IPB and the Minister of Education, which is having the opportunity to increase the performance index inbound by inviting speaker from 100 of the world top university. Tepuk tangan ya, kita kedatangan ini narasumber dari Sydney U. Oke, Sydney University. Sydney U itu dekatnya itu. Kalau dulu pernah lihat film Finding Nemo ya. Tahu? You know Finding Nemo? It's very famous cartoon in Indonesia. We hope that this morning session goes smoothly and provide the new insight to all participants. We intend to organize more collaboration in the future, whether in the form of the workshop or other collaboration schema. Once again, we express our deepest gratitude to Sintesa Animalia, Animal Australia and Farm Well, and of course the speaker who has taken the time to attend and visit to our campus. Jadi I hope in the next time we can create a lot of collaboration, a lot of research, and I also introduce my campus. We have animal hospital, we also have equestrian park, and we have poultry head research farm. Maybe in the next time we can create some community development involve vet university in Indonesia, organized by Sintesa Animalia. Oke, tepuk tangan buat. Okay, the end of this time, I would like so thank you for visiting our university. Have important knowledge about the anesthesia and euthanasia. Oke, terima kasih banyak juga PDHI yang sudah hadir di sini. Terus ini ada Dr. Tris, ini juga ketua PD. Ya, tepuk tangan buat Dr. Tris ya. Oke, terima kasih banyak. Mohon maaf atas segala kesalahan. Nanti silahkan dimanfaatkan sebanyak mungkin pengetahuan yang akan diberikan oleh narasumber yang sangat spesial pada pagi hari ini. Terima kasih banyak. Pulau Irian, Burung Cendrawasih, cukup sekian. Terima kasih. Thank you. Assalamualaikum warahmatullahi wabarakatuh.
Thank you so much, Dr. Andrianto, for your opening speech. The next one is from the representative of Farmwell, Mr. Bruce McConnell. For Mr. McConnell, the time is yours.
Assalamu alaikum. Hello and good morning. It is an absolute honour to be here this morning and to bring my colleague, Dr. Gabrielle Musk, over here to perform this guest lecture. Farmed Well is a large philanthropic organisation based in Australia, looking to improve farmed animal welfare right across the globe. We assist in improving farmed animal welfare here within Indonesia and take our learnings from here and take them right across the world. It is an absolute honour to be here in this university, one of the top 100 agricultural universities in the world, and have this partnership at its very formation stage. We believe you as vet students are the future of animal health and welfare. You are the profession that goes and deals with animals every day and teaches lay people, those people who own their companion animals or run their farms, what is the right thing to do for their animals. So the impact you will have on farm animal welfare, or all animal welfare, can never be underestimated. And that's why we believe collaboration with universities is a great way for improving animal welfare around the world. And as I said, really excited to just start the collaboration now. Now I know it's hot in this room and I know we're running a bit late. So for me, that's it. And I can't wait to hear Gabby's presentation to you. And importantly, please ask any questions you have of Gabby while she's here, and use all of her experience to further your learning while she's here in this room with you. Thank you.
Thank you, Mr. McConnell, for your speech. The next one is from the representative of Indonesian Veterinary Medical Association, Dr. Sinta Rizanti. For Dr. Sinta, the time is yours.
Assalamualaikum warahmatullahi wabarakatuh. Selamat pagi, salam sejahtera. Om Swastiastu, Namo Buddhaya, salam kebajikan, salam sehat. Selamat pagi kepada Bapak Dr. Adrianto, selaku Wadek IPB University, SKHB IPB University, lalu Ibu Tris, sekarang sebagai Ketua PD, dan kepada yang terhormat pembicara kita pada hari ini, Dr. Gabriel Mas, dan dari Farmwell, Sintesa Animalia Indonesia, dan satu lagi tadi Animal Australia. Ya, okay. Thank you for your coming visit our SKHB IPB University and to give your knowledge for our students. We hope they can learn much about analgesic euthanasia for improve to the animal welfare. Buat adik-adik semua, selamat pagi. Semoga apa yang hari ini telah diusahakan dari kampus, dari SKHB, dapat memberikan tambahan ilmu, tambahan wawasan buat adik-adik, terutama untuk anestesi, obat-obat anestesi yang dapat digunakan di hewan. Kita sebagai dokter hewan, kalau melihat judulnya mestinya ini akan memberikan lebih animal welfare-nya ya, penggunaan anestesi yang terus menjaga animal welfare supaya kita tetap menjaga hewan tersebut tidak kesakitan. Jadi mungkin kita perlu ingat bahwa kita juga nanti jika adik-adik akan lulus sebagai dokter hewan, kalian juga nanti akan disumpah akan menjalankan profesi dokter hewan kalian secara bertanggung jawab. Jadi di situ ada etika-etika profesi yang harus kalian jalankan, baik sebagai dokter hewan terhadap pasien maupun terhadap kolega. Jadi di saat ini mungkin kesempatan yang diberikan oleh kampus, kesempatan yang luar biasa yang tidak selalu ada di setiap tahun. Beruntunglah kalian yang hari ini meluangkan waktu untuk bisa hadir di sini untuk mengikuti mempelajari, menambah ilmu dan wawasan mengenai obat anestesi. Selamat mengikuti seminar, semoga bermanfaat untuk adik-adik semua nanti terjun di lapangan. Selamat belajar, semoga nanti lulus dengan baik dan nanti bergabung bersama kami di Perhimpunan Dokter Hewan Indonesia. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you so much, Doctor, for your speech. Before we start, as a token of our appreciation, we would like to present a certificate for Dr. Gabriel Mas and a souvenir for Farmwell as a symbol of our gratitude. I would like to ask Dr. Andrianto, Mr. Bruce McConnell, Mrs. Jess Calcutt, and Dr. Gabriela to join us. I would also like to ask Mr. Giovanni Manuel to join us here. The next agenda is group photo, so I would like to ask everyone to join us here for a group photo. Seluruh peserta bisa maju ke depan. Terima kasih. Ladies and gentlemen, we have a great agenda for you today. This lecture will be divided into 2 sessions. The first session will cover the main point regarding veterinary anesthesia, and the second one will cover the main point regarding analgesia, quality of life, and euthanasia. We encourage you to take notes and hold on to any questions you might have until the end. We will aim to have a question and answer sessions at the end of each presentation. We also have some prizes for the participants who's asking any questions. Before we start, please let me introduce our guest lecturer. Dr. Gabriel Mas has extensive experience in the biomedical research environment, veterinary clinical work, and teaching vet students. She has published more than 80 manuscripts in the peer-reviewed veterinary and medical literature. Dr. Gabriel Mas is the principal researcher in animal welfare at Farmwell, Australia. She is also an honorary research fellow at the School of Human Science, University of Western Australia. She is also an adjunct senior lecturer in the Veterinary Anaesthesia and Analgesia at Murdoch University. Without any further ado, everyone, please welcome Dr. Gabriel Mas.
Terima kasih. The fun's over. We're going to get serious now. So thank you all for coming, especially on a Saturday. In Australia, the vet students have Saturdays as a weekend, so I'm very impressed to see so many of you here. 2 seconds. Okay, this morning I'm going to divide the lecture into 2 halves. The first one we're going to talk about veterinary anaesthesia, and in the second one we'll talk about analgesia, quality of life, and euthanasia. The first one's going to be quite technical and hopefully quite practical for you, and the second half will be a little more maths anymore. I then worked in practices, so looking after dogs and cats and farmed animals and wildlife for 6 years before I undertook a training program at the University of Glasgow in Scotland, which is a very cold place to live, very different to here. And I studied there for 4 years and became a specialist in veterinary anaesthesia and analgesia. But I got a bit homesick after that and moved back to Perth and undertook a PhD at the University of Western Australia. And since then, I've worked teaching vet students, doing clinical work, and also looking after animals that are used in biomedical research. About a year ago, I started in this job at Farmed Well, working to talk about the welfare and how to improve the welfare of farmed animals around the world. But today, to be clear, we're going to be talking mostly about dogs and cats. So as a vet in Western Australia, we have to all agree to the conditions of our oath when we start to work as a vet. And I wanted to show you this so you understood the obligation that I have as a vet from my country and the importance of ensuring that I always work to look after the health and welfare of the animals in my care. I'm able to read a copy of your oath as well, kindly provided by my colleagues in Indonesia. And again, there's a very similar obligation that you have as vets to ensure the health and welfare of animals and to relieve their suffering wherever you can. We're not unique. This is the job of vets all around the world, and in the United Kingdom, again, it's very similar. Vets need to ensure that they're always dedicated to relieving the suffering of animals and ensure that their health and welfare is their highest priority. And America's the same. So I just thought we'd start with the concept of welfare, and then we'll drill down to the specifics of anaesthesia and analgesia. So welfare basically refers to the way in which an animal copes with the environment within which it lives. So that will be very different if it's an animal that lives in a home with a family, or an animal that lives on a farm, or an animal that maybe doesn't have a home. The way in which it copes with the environment within which it is in determines its welfare. And there's a number of factors that contribute to the welfare, and they're shown here. So the first one is nutrition, and that refers to ensuring that the animals have good food and water and appropriate nutrition, depending on what sort of animal they are. The physical environment is also very important, so they need to have adequate shelter, and they need to be able to do the things that that animal would normally do. So the physical environment for a hamster would be very different to that for a cat or a horse, for example. Health is very important as part of welfare, and we as vets are especially good at the health side of things, so I'm not going to talk too much about that today. And then finally, behaviour also contributes to welfare, and it's not just the behaviour of the animal with other animals of the same species or animals of different species, but also the behaviour of that animal and the way it interacts with people, and that's where we can have a lot of control. Those 4 factors feed into the mental state, so how the animal feels and how it's coping with the environment with which it's in, which determines its welfare. Okay, so that's the sort of big picture. We're going to drill down into anaesthesia and analgesia now, which contribute to welfare in many, many ways, which I think you'll see as we go along today. Okay, so as I said, I'll start with anaesthesia, and then in the second half we'll talk about analgesia, quality of life, and euthanasia. This is a picture from the beach near where I live. This is my dog Harry at the front, the black and white border collie, and you can see he's having a great old time. You're going to meet Harry a few times today, as he's very useful as a case to try and understand the importance of managing welfare. Okay, so to begin with, I always find it especially helpful to define the words that we're using so we're all on the same page. So anaesthesia is defined as the controlled and reversible intoxication of the central nervous system where the patient neither perceives nor recalls noxious stimuli. So that's especially important, and the main words there are that it's controlled and reversible. It's important that the animal can recover after the anaesthetic, and the best way for that to happen is to ensure that we can control the conditions during anaesthesia. And that can be done by monitoring and paying attention to the animal during that process. Anaesthesia has come a long way since the 1600s. So this photo, or this picture rather, is from the 1600s, so almost 500 years ago, where the first anaesthetics were very simple. A bit of ether would be put on a handkerchief and held onto somebody's face, and they'd breathe in the vapour and become anaesthetised. Initially, this process wasn't very controlled, and it wasn't always reversible, so it was quite dangerous. But it was the beginning of a period where anaesthesia was developed, and it enabled people to undergo procedures, perhaps surgery to treat an injury, without feeling the pain, and it enabled the development of medicine as we know it today. Animals got involved a little bit later, and they weren't considered capable of feeling pain or capable of suffering at this point in history, so their care was very different. And as a veterinary anaesthetist, we've learnt a lot from our medical colleagues about how best to approach anaesthesia. So this is the kind of clinical context today. I'm sure these pictures are much more familiar to you. And anaesthetising animals today is a much safer, a much controlled process than that photo from before with an ether handkerchief. So why do we anaesthetise animals? There's various reasons. Probably the most common is to perform surgery. We may also anaesthetise animals to just keep them still, to get a good quality radiograph or an X-ray. And sometimes we need to anaesthetise them purely to examine them thoroughly if they are uncooperative or they're very painful and don't want to be touched in the spot that we're very interested in. So when it comes to anaesthesia, there's a number of reasons that you would perform anaesthesia, and in order to do it in a controlled and safe, reversible way, The aim is to develop a balanced anaesthetic, okay? So the main features of a balanced anaesthetic are that the patient's muscles are relaxed, that they're unconscious or asleep, that's narcosis, and that they're not responding within the body to any stimulus that may be painful. So that's anti-nociception. So there's no single drug or single way in which to create a balanced anaesthetic. The procedure to achieve balanced anaesthesia can only be achieved by using a combination of drugs. So I thought I'd also take this opportunity to differentiate general anaesthesia from local anaesthesia. So mostly what I'll be talking about is general anaesthesia, where the patient's unconscious, and local anaesthesia refers to just when you use a drug around a specific part of the body, around a nerve. There's a number of factors to consider when you're undertaking an anaesthetic, and they're determined by the animal, by the people that are performing the procedure and how much skill and experience they have, the equipment that you have available, and the drugs that you have available as well. And that varies around the world, and it's important, if you've got the basic principles, then you can adapt your equipment, your skills, your experience, and the drugs to the situation. Okay, so we're going to talk through the steps of general anaesthesia. So this is where the practical stuff comes in. To begin with, it's always important, there's a lot of steps there, and you'll find that as you get more experienced and as you do anaesthesia more often, you'll be able to walk through those steps quite quickly sometimes, and other times you'll need to stop and think a little bit more carefully. So to begin with, preoperative examination is essential. It's important you understand the condition of that animal, its history, any blood test results that you may have, any x-ray results, anything that may be relevant to the procedure that's happening. For example, if they've already been on some medication to manage pain or medication to manage epilepsy, then that's important information to have because that may impact on how you progress with the anaesthesia. So this student's performing a physical examination on this goat. She's not going to find the heart up there, but that will come with a bit more experience. Okay, so once you've done a thorough preoperative examination, then you move on to deciding how to prepare the patient for the anaesthetic. So what do you need to do to ensure that the animal is going to survive anaesthesia, it's going to be safe and effective? So the things to consider here are whether or not preemptive analgesia is appropriate. So if you are going to perform surgery, then preemptive analgesia, which we'll talk about in the second half of today, is very important. It's also important at this point to think, is there any medicine that I may give the animal that's going to be helpful for the procedure? So if you, for example, had a cat that had a obstruction of its urethra because of stones in its bladder, then it may be important to treat the high potassium levels before you anaesthetize the animal. Otherwise, it would be very dangerous. You also need to think about whether or not you would withhold food and water from the animal at this point, and it would be standard to withhold food overnight and let them drink water up until the last minute. Okay, so we've evaluated the patient, we've thought very carefully about all of the considerations for anaesthesia, and now we've got into the nitty-gritty of it all. Okay, so the first step, and it's routine in a lot of the places that I have worked, to pre-medicate the patient, which involves giving a pre-med, is what we call it, and that is a combination of drugs to calm the animal down, make them a bit more relaxed. It doesn't anaesthetize them, it's just a sedative or a tranquilizer, and that will enable them to perhaps be a little bit more cooperative and also decrease the dose of other drugs that we need to give. So by far and away the most common pre-medication used in animals, dogs and cats, is a drug called acepromazine mixed with an opioid or even something like a benzodiazepine like midazolam or diazepam. So acepromazine is used for probably 99% of pre-meds in most places that I've worked. So this will ensure the animal's nice and calm and relaxed. It's much more dangerous to anaesthetise an animal that's stressed and concerned about things. They respond to anaesthesia very differently, and it can be much more dangerous. So after they're pre-medicated, the next thing to think about is whether or not intravenous access is appropriate. And it's standard in where we work to put in an intravenous catheter beforehand, and that enables the delivery of other drugs, the delivery of fluids, and if there's an emergency, you can manage that problem very effectively because you've already got access to a vein. So sometimes we might place the IV catheter after the animal's anaesthetised, but if possible we do it before, and then we use that catheter to deliver the anaesthetic drugs. Okay, so we've got the animal ready, it's been pre-medicated, we may have IV access, intravenous access, and the next step is induction of anaesthesia. So the two most dangerous parts of anaesthesia are induction and recovery. Some people say it's like flying a plane, where the dangerous parts are the takeoff and the landing, and the middle bit's nice and relaxing. That's the aim with anaesthesia, that the middle bit's nice and relaxing. But the induction and recovery are where you're shifting from being conscious to unconscious, and then the other way. So it's really important that this part's done very carefully, if at all possible. So ideally, giving just enough drug to get just the effect you want is what you'd like to do. So that's best achieved by using an intravenous injection of drug, so giving the drug into the vein. The most common drugs used for induction of anaesthesia in Australia would be propofol, alfaxolone, or a combination of ketamine with a drug like midazolam or diazepam. Thiopentone is also used, and sometimes other combinations with ketamine. But those drugs are invariably given intravenously, so you calculate what you think you'll need and then give it slowly into the vein and give it just enough to get them adequately anaesthetised to put a tube into their trachea, which is the next step. So after the animal's unconscious, and you've confirmed that it's unconscious by checking the palpebral reflex and also muscle tone and any response to perhaps a pinch of the toe, then it's time to put an endotracheal tube into the airway. Now, some animals can manage without an endotracheal tube, but most dogs, especially brachycephalic dogs with the squashed up face, putting an endotracheal tube in those is very important. Cats are able to manage their airway most of the time without an endotracheal tube, but it's still much more safe to put an endotracheal tube in cats as well, again, especially if they have a squashed up face. So to put an endotracheal tube in, that's a very stimulating thing to do. If they're not adequately anaesthetised, they'll respond and cough and carry on, and there's no value in trying to put a tube into an animal that's not ready to have one. And if they're not ready to have a tube in their throat, then they wouldn't be ready to have surgery either. So the endotracheal tube needs to go into the trachea. It's easy when you start learning to accidentally put it into the esophagus, and that's okay, that's part of learning, but it's really important when you are learning to ensure that you've got some ways in which to check that you've put the tube into the right place. So the best ways to check that are to have a look and see. With dogs and cats, you can visualise the larynx very easily. So especially if you have a light, maybe a head torch or a laryngoscope, so you can see the larynx. Otherwise, the best way to test that you're in the right place is to measure carbon dioxide coming out from the tube if you have a capnograph. So they won't have carbon dioxide coming out of their esophagus from their stomach unless they've had a big drink of Coca-Cola beforehand, which most dogs and cats haven't done. So you'll only get carbon dioxide if you're in the right place. If you don't have a capnograph, that's okay. There's other things that you can do. You can also palpate the neck, and if the endotracheal tube is within the trachea, then you won't be able to feel it because it's within a cartilaginous structure. But if it's in the esophagus, you'll be able to feel the tube, the plastic tube, and the trachea as well. So you need to take it out and try again. And lastly, you can also check that you're in the right place by watching for movement of air. So if you have a little bit of cotton wool or a bit of hair from the animal, you can see it move as they breathe in and out. You could also, if you connect it to an anaesthetic machine, you can see the bag on the machine move as the animal breathes. So there's many ways that you can check if you're in the right place, and if you're not 110% sure, then you should check again or check by a different method to make sure you're in the right spot. If you're in the wrong spot, the risk of an accident is much, much higher, okay? All right, so then once they've had anaesthesia induced and an endotracheal tube has been placed, then we're into the maintenance phase of anaesthesia. So this should be the relaxing part. You should be able to sit back and have a cup of coffee and put on the music and let the surgeon do their thing. But this is the time to pay really careful attention to everything. So we'll talk about monitoring in a little bit, but the maintenance phase of anaesthesia is usually achieved by delivering a gaseous anaesthetic like isoflurane, but you can also achieve ongoing anaesthesia by delivering an injectable drug, either by intravenous injections, or an intravenous infusion, or by giving extra top-ups of your intramuscular anaesthetic if that's what you use to induce anaesthesia. So there's also, I'll just mention in here, we talked about a balanced anaesthesia and that no single anaesthetic drug will achieve a balanced anaesthetic, but a combination will. So depending on what you've already given, you may find it helpful to add in some extra things at this point, like a local anaesthetic block perhaps. And the pictures on the bottom are of a dog having an epidural, which gives drug into the epidural space down at the base of the spine there, and that will desensitize or analgese the back legs and the perineum, and also part of the abdomen. So that can be a very useful way to achieve a more balanced anaesthetic by using an adjunct like an epidural injection. A really simple way to achieve extra analgesia and to complement your anaesthesia at this point is, and if you haven't used much local anaesthesia, the best way to start is to use local anaesthetic blocks when you're doing dental procedures. So if you're removing teeth or treating bad teeth, that can be really painful for an animal. And dental blocks, so putting a little bit of local anaesthetic around the nerves in the face, can be really helpful. And there's lots of amazing diagrams in books that show you exactly where to go. So that's the top picture up there. Okay, so from there, in order to maintain anaesthesia with an isoflurane, a gaseous anaesthetic, you have to deliver that anaesthetic through a breathing system. So breathing systems are important to check beforehand. So this is something you've set up beforehand and made sure it's working and there's no leaks. But there's two main classes of breathing systems. So there's those where the patient will re-breathe the air in the system. They're called rebreathing systems. And there's those where the patient won't rebreathe, and they're called non-rebreathing systems. In a rebreathing system, the gas that needs to be removed before the gas is rebreathed is carbon dioxide. Otherwise, it's very dangerous. In a non-rebreathing system, the carbon dioxide is removed by setting a high flow on your flow meter on your machine to ensure that the carbon dioxide is flushed out between each breath. And they're used for smaller animals, so cats and small dogs. But if you've got a larger animal and you're using a rebreathing system, then the carbon dioxide is removed with the soda lime or a carbon dioxide absorber that's within the breathing system. So there'll be a canister with some little rocks in it. There's special rocks that can absorb the carbon dioxide, and they will change colour when they absorb it, so you know when they can't absorb any more and change it over. Don't think that's going to work. The top diagram there is a rebreathing system, and you can see that it's a rebreathing system because it has a canister of soda lime in there in the top diagram. And the bottom diagram is 6 different types of non-rebreathing systems. They can be quite complicated. There's lots of different versions of them, and often a clinic will just have 1 or 2 of them, and once you know which one you've got, you work with that and get used to it. So I mentioned the importance of removing carbon dioxide in these breathing systems, and if you're not sure if you're using them properly, the best way to check that you are is to use a capnograph. So the top graph there, the capnogram, goes back down to the bottom, to the baseline between each breath, which shows that no carbon dioxide is being rebreathed. The second diagram on the bottom left there, another capnogram, you can see the difference is that it doesn't go down to the baseline between each breath. So that means that carbon dioxide is being rebreathed, and that's very dangerous, and that means you've got an equipment issue that you need to fix very quickly. Do you have capnographs in your clinic here or the clinics you've worked in? Have you seen that equipment before? Yes? Couple of nods, that's wonderful. If you had money to buy one machine to monitor anaesthesia, a capnograph would be the best one because it tells you about breathing, but it also tells you about blood supply to the lungs, so you get an idea of both respiratory and cardiovascular performance. They can be quite expensive, but they're very useful pieces of equipment. I see some nods there, agreed, but they're well worth it. Okay, so you should have made this decision beforehand when you're planning your anaesthetic, but not always. Sometimes you have to change during the procedure, and that's whether or not the animal's going to breathe on its own or you're going to ventilate for them, you're going to breathe for them. And this is called intermittent positive pressure ventilation. So it's intermittent because it's on and off. It's positive pressure because you're forcing gas into the lung. During a normal breath, there'll be a negative pressure created. So this positive pressure is a difference. And then ventilation. So if you need to apply intermittent positive pressure ventilation, then you can either do that manually. So this student here is going to squeeze the rebreathing bag every however often during the procedure. So it depends on the animal, but maybe 10 times per minute, maybe 12 times per minute. Every 5 or 6 seconds, he needs to squeeze the bag. That's a big job for an hour. There's a lot of squeezing, so sometimes a machine is more useful. So a mechanical ventilator. So if you think you're going to need mechanical ventilation, then you need to set that up beforehand and have it all ready and checked and good to go. And mechanical ventilation would definitely be required if you're going to paralyze an animal or if you're going to do surgery in the chest. But it's also really useful if you have perhaps a pregnant animal that's got a really big belly and you position them on their back. They won't breathe very well because all of that pressure on the diaphragm will make it difficult, so ventilating them may be very helpful. Okay, so moving on to fluid and blood loss management. So we talked earlier about having intravenous access all set up and ready to go. Animals obviously can't drink during anaesthesia, and they've probably not drunk very much beforehand because they're a bit worried about the new environment that they're in. So it's important to provide some extra fluids during anaesthesia. If it's a procedure more than perhaps half an hour, then it's a good idea to do that at just enough to maintain their fluid level and maintain their blood pressure. So if you have IV access, that's very easy. And the simplest thing to do is to deliver an isotonic balanced crystalloid. So that's something that has a similar composition with regards to electrolytes in the blood. And a classic example would be Hartmann's or lactated Ringer's solution. If you have an animal where something's gone unexpectedly wrong and there's been a lot of bleeding in the procedure, then you may need to give blood or a colloid or something stronger than a crystalloid. And having your IV access all set up and good to go is really helpful there. Okay, so the next thing to think about is also body position. So the way in which the animal is positioned during the procedure will have a big impact on how it recovers. So it's especially important for really big animals like horses who are really heavy, maybe 500 kilos of muscle getting squashed can cause big problems during recovery. It's also important for dogs and cats as well. So if you put a dog or a cat perhaps on their back for surgery like a laparotomy and you stretch out their legs, then that may damage the nerves and the muscle, and that will really hurt when they wake up. So again, think about positioning so they're on a nice soft padded table and you're not stretching a limb in a really weird position for too long. It's hot up here. Is it hot for you guys too? There's a few fans, it's not just me. Well done, and I'm impressed you're not all falling asleep in this balmy. It's hard when you talk about anaesthesia because it's about going to sleep, but that's not what I want you to do. Okay, so body position is really important, and if you can, with a horse here, we've paid really careful attention to the position because it's such a big animal, and done little things like pull out the front leg so the muscles of the front arm aren't squashed too much. Okay, here's Harry again. You're going to meet him a little bit more. I just put this photo here because I like it. But during anaesthesia, especially if you're using ketamine, which dries the eye, it's really important to have something over the surface of the eye, a lubricant, to protect it from drying out. The worst thing to happen is to do the anaesthetic and the surgery really well and forget about that part, and the animal wakes up with a really sore eye that needs to be treated for a week or so. So even for really short procedures, but especially for short procedures where you're using ketamine in your anaesthesia, put something over the eye, so just a lubricant that doesn't have any antibiotics and doesn't have any medicine in it, just a plain lubricant on the surface of the eye. Temperature. Now, hypothermia is the commonest complication of anaesthesia. If we were doing anaesthesia in here today, it probably wouldn't be a complication, but in an air-conditioned surgery, then hypothermia is the most common complication that happens during anaesthesia. And if it happens, it will take the animal a lot longer to wake up. They're more likely to have post-procedural infections or bleeding issues. In people that are hypothermic during their surgery, they stay in hospital for longer. So it's really important to measure their temperature and make sure they're not getting cold. Hypothermia develops in steps. So right at the beginning of anaesthesia, the temperature may drop by a couple of degrees, then flatten out, then drop again and flatten out a little bit. Warming them up again afterwards takes a lot longer than it does for their temperature to drop. And the big issue with hypothermia is that it takes them a lot longer to wake up, especially if you've used injectable drugs. Okay, monitoring. So this is a task for someone dedicated to looking after the animal that's anaesthetised. That person could be a vet nurse or another vet or somebody who knows how to pay attention to the animal during the procedure. It's routine that anything that's observed or measured would be written down on an anaesthetic record at least every 5 minutes. So if you're doing surgery for an hour, you'll have 12 parts of your record with that information on there. And anything that you measure should be written down. And the minimum that you would record would be the heart rate, the temperature, and the respiratory rate. But if you're measuring blood pressure or you have a capnograph, you write that information on the anaesthetic record as well. along with anything that happens that may be relevant to the procedure, like the surgeon cut the blood vessel and didn't stop the bleeding quickly enough, or the surgeon accidentally pulled on the vagus nerve and the heart rate dropped. It's always the surgeon's fault, so that's another rule of anaesthesia. Blame the surgeon. But anything that's relevant to the anaesthetic should be on that record. And that's really important to ensure that you meet that definition we talked about earlier, that the anaesthetic is controlled and reversible. Oh, the other thing, so I mentioned before, you should at least monitor heart rate, temperature and respiratory rate, but you must always continuously monitor depth of anaesthesia to make sure that they're adequately anaesthetised for what's going on. So that's much more subjective. So you're checking their palpebral reflex, their muscle tone, how they respond if you pinch their toe. So that's sort of more general impression of how they're going. But it's important that you check that all the time, especially just before the surgeon wants to start the surgery. So monitoring is difficult. So the target site or the effect site of anaesthetic drugs is the brain. So we talked about that central nervous system depression. So the brain is where the anaesthetics work. It's very difficult to monitor the brain though. In humans that are anaesthetised, it's a bit easier. So there's equipment to monitor the central nervous system depression. But in animals, that's not possible for us yet. Maybe one day. The problem with animals is that they're all so different. They've got different anatomy. They've got a lot of hair on their head. It's a lot more difficult to do that with an animal. So what we're left with is, if we can't monitor the central nervous system very well, then we need to monitor the things that the central nervous system affects. So the drugs will affect the brain, and then in turn they'll affect the cardiovascular system, the respiratory system, the musculoskeletal system, and the thermoregulatory system. And they're the things we can monitor. Okay, we can look at heart rate, we can look at blood pressure, we can look at respiratory rate. If we have a capnograph, we can look at adequacy of ventilation. We can check muscle tone. Perhaps the most common muscles to check are the jaw muscles, because they're usually easily accessible and they give a good indication. If the animal's inadequately anaesthetised, then it's not going to let you open its mouth really easily. And again, temperature, so measuring temperature. The thermoregulation system is the most common system to be significantly impacted during anaesthesia. Okay, so now we've come to the end and we're into the landing phase, which again can be very dangerous, transitioning from being unconscious to conscious. We need to wake the animal up in a nice, quiet, calm environment that's not too hot and not too cold. We need to make sure they're nice and comfortable, that they're not painful. We need to take the endotracheal tube out at just the right time, which can be quite tricky. If you take it out too early, then they may have problems with their airway, and it may be too hard to get it back in without giving them more anaesthetic. And if you take it out too late, it's very irritating, but they could even chew it and aspirate half of it. That's a disaster. So that observation during the recovery period has got to be continuous. This 5-minute thing goes away and it's absolutely constant observation until they're able to hold their head up and swallow and then walk around and have something to eat and to drink. Okay, so we're almost finished with our first half of today. And we talked about balanced anaesthesia, and remember the combination of things to create a balanced anaesthetic include anti-nociception, unconsciousness and muscle relaxation. Analgesia relates to the anti-nociception part of that balance, and analgesia involves the administration of drugs that relieve pain, or doing other stuff that relieves pain, like keeping the animal nice and comfortable with a soft pad to lie on, or it's just some tender loving care. So this is a dog here that's been hit by a tractor earlier today, and he's had a lot of injuries and ended up having to have surgery to have one of his legs removed. So he's only got 3 legs left. And what is your impression? Do you think he looks quite comfortable? Does he look relaxed and happy after his surgery, or does he look like he might need some extra attention? If you think that he looks quite happy and comfortable, put your hand up. If you think he looks like he needs some extra attention, pop your hand up. Okay, everyone's very shy. Thank you. It's easier for me because I was there and I could interact with him, and you've only got a photo. But from the photo, I think you can probably appreciate his face looks a bit worried. He's a bit nervous, and he's not sitting up at all. He's lying flat out on his side. So he needed a little bit of extra attention, and we thought very carefully about his analgesia to help him improve. But analgesia is complicated, and it helps if you understand the processes of pain and the options for giving analgesic drugs, which we're going to talk about in the next half of today. So to finish off, I'll just remind you of the definition of anaesthesia. I'm not going to test you on this. I did hear your professor say there's no exam for today, but maybe I'll email him some questions to make sure that you've been paying attention. But it's a controlled and reversible intoxication of the central nervous system where the patient neither perceives nor recalls noxious stimuli. So if you can lock that into your brain, even if you're not going to have an exam on it, it will help you understand the processes of what you're trying to achieve during anaesthesia. It's a balanced approach. It requires careful consideration of all of those steps. Those steps get easier as you get more experienced, but every now and then an animal will come and it'll make you stop and think much more carefully about each of those steps. And if you've got a lot of experience doing healthy animals that are a little bit simpler, then you can be much better prepared to tackle a more complicated case. So that balance is achieved with muscle relaxation, unconsciousness or narcosis, and anti-nociception. Okay, we will have a break now, and I'll hand over to our MC.
All right. Thank you, Dr. Gabriela, for your presentation. So that's the end for the first session. We have now reached to the question and answer session for the first presentation. Please raise your hand if you have any questions. We have some questions. Yep.
Okay. Good morning. My name is Dr. Caraka. I'm currently a veterinarian of the Food and Agriculture Organization in Indonesia.
Oh,
sorry. So you can hear me better.
That's much
Okay.
better.
So my name is Caraka. I'm a veterinarian for the Food and Agriculture Organization currently in Indonesia. But previously, before I worked in FAO, I worked as a veterinarian in cattle farm.
Okay.
Yes, so
The
cattle,
microphone a bit closer.
cattle veterinarian. So in the place where I work in Kalimantan, we have quite a limitation of supply and for both medicine and also tools. So it's not always, mostly it's not ideal to conduct surgery there. With your experience, I would like to ask how to deal with such situation. For example, when we have an operation, a surgery, that we have to extend the time because we don't have a respiratory anesthetic.
Yeah.
So we mostly use injectable anesthetic, and sometimes we have to extend the surgery because of the difficulties, so on and so forth. How's the best way to do it to prevent the animals from passing on? So,
Okay.
Thank you.
I find it really interesting. I think there's a lot of challenges in an environment where you don't have as much opportunity for control, and control is really important. A lot of people think anaesthetists are quite controlling, but they have to be. But that control is harder when you don't have as many options. So I guess in an environment like that, it's important to select the animals very carefully, make sure that they're healthy and that the procedure that they're undergoing is really necessary. And that the procedures can be done by a good surgeon, so it doesn't take too long, okay?
I mostly done it, it's not just the tools, but also sometimes I done it by myself, so because I don't have any
You're doing both.
assistance.
Okay.
Yeah, so
well, you know how
sometimes,
good you are, so you'd be nice and
sometimes
quick.
pretty difficult.
Do you put an endotracheal tube in? Do you put an endotracheal tube in?
No, because back then I don't have one. Yes.
Right.
Yes.
Yeah. Okay.
But that's one thing that might have to be noted in the future that we should prepare.
So that's a really good way of increasing the safety. So if you're using xylazine and ketamine by intramuscular injection, then if you put an ET tube in and they can just breathe room air or outside air, then that will help their oxygenation. And they don't have to work so hard to breathe because the tube keeps everything open. So an endotracheal tube that's the right size, so you have to have a few because dogs and cats are different sizes, and it has to fit into the trachea just right. If it's too small, they'll find it harder to breathe, and if it's too big, it'll damage the airway, and that can be very dangerous. So one way to improve the safety of the environment that you're in would be to use an endotracheal tube. They're sold to be used once, but you can use them many, many times. You just wash them in between, and they have a cuff which is to be inflated, and that's what gets damaged, and that's when you get a new tube. But you can use, if you look after them carefully, you can use them like 100 times, many, many times. So having an ET tube will help. That'll help with their breathing and their oxygenation, and then keeping the procedures nice and short. But the tricky thing is with your situation is if you need to prolong the anaesthesia, then you need to give an extra intramuscular injection, and knowing when to give it and how much to give is really tricky. So as a general rule, if you're using xylazine and ketamine, it'll probably last 40 minutes or so.
Yes, usually something like 40, 45.
Yeah.
Yeah.
So if you know that you're coming up to that time point, then and you can check the animal a bit, or if you're the surgeon, you can feel the muscles. That's really helpful. Then you can give an extra bit of a dose, and I'd probably just give like a quarter of a dose. And it's better to do that before they start to wake up, because then you have to give more, and they've had a period where they're inadequately anaesthetised, and that's not in their best interests. So you can start, and that's where, even if afterwards you make a note of what you gave when you gave it, and then you can really understand the pattern of when to give more. But if you can, at the 40 to 45 minute mark, give a quarter of what you gave to begin with, then that will give you another like 20 minutes or so. So it gives you longer than the proportion of the first dose as a proportion of time, but then you can continue to do that. The problem with giving lots and lots of intramuscular doses is that it starts to build up in the body, and they take a long time to wake up. So you can reverse the xylazine, but not the ketamine. So do you reverse xylazine sometimes, or so there's a drug, yohimbine or atipamezole, that can be used to reverse the xylazine, which will help them recover. But you don't give that too early, because if you do, then the ketamine will make them feel awful.
Back then I usually add it at something like 5 minutes before, like 45, so I give it during the 40th minute after my surgery.
Okay,
Yeah.
that sounds like a good timing,
Sounds
yes.
okay.
So but I think a big difference that you could do to make improve safety is to put an endotracheal tube in.
Okay.
And it's good practice to do that, because then sometimes you might really need one, and if it's just become part of your routine, then it's not something that you need to fret about.
Okay. Thank you.
got the industrial. Ooh. You can join me if you like. Is there any more questions? Yes. Got the cat joining me. Hello.
Okay, you can call me Abid, and I come from IPB University at co-assistant or internship program.
Ah, wonderful.
Okay, my question is because it is hard to know where the recovery phase is when you can time right for the give to water or some food in the recovery. Do you have any tips for the recovery zone in there?
Sorry, I didn't quite catch that. Can you say it again?
Do you have any tips for we can take care of a better recovery phase from the post surgery from any other animal, cats and dogs and such?
For where to measure the pulse?
Yeah, post recovery.
Sorry, I'm not sure. Post recovery. Okay.
Yeah.
Sorry.
Okay. And
my Indonesian doesn't exist, so I'm very impressed with your English. So I apologize for not understanding.
Yeah.
Okay. We can talk about that.
Yeah, and then do you? It is which one is better? We can wait for the anesthesia to decrease, or we can just walk the animal with the antidote.
With the adapamazole?
Yeah.
Yeah. Okay.
And which one?
So,
Thank you.
do you always use xylazine and ketamine, or do you sometimes use isoflurane to maintain anesthesia?
From which I experienced, we sometimes use isoflurane, but not always.
Okay, so the recovery question depends a bit on the drugs you've used. That's why I ask. But in general, in recovery, it's important to have a nice quiet environment that's not too bright, there's not too much noise, and it's nice and comfortable for them. But it's really important as the vet to make sure that they've had enough pain relief for the procedure so they don't wake up in pain, because that's really scary. And they get quite disorientated if they're not familiar with the environment. So I think it helps a lot to have maybe a nurse or the vet that they've met before the procedure to be there afterwards as well, to give them a bit of comfort. A lot of the ways that you manage the recovery are really about the other stuff, not the drugs and so on. But it's so pain relief, a nice quiet, calm, not too bright environment, nice temperature, a nice comfortable bed, and I think they're the main things really. But and having familiar people around. If you've used isoflurane, then the recovery is quite it can be quite short, relatively short. They wake up quite smoothly. But if you've used injectable anaesthetics, it can be a bit different, because that takes a lot longer. The way the body removes isoflurane is by breathing. The way the body removes injectable drugs is by metabolism, which takes the body a lot more time. So it can be slower, and they can get colder, and you can be busy and go off and do something else because they're taking too long, but it's still important to look after them, and that's where giving adapamazole is really useful. But if you give adapamazole too early, then the ketamine makes them have a horrible experience. So if you use xylazine and ketamine together, it's a good idea to avoid adapamazole until a good 20 or 30 minutes after any ketamine was administered. You can give adapamazole in an emergency. If they're looking like they're going to die, then you give it. It's only supposed to be given into the muscles, intramuscularly, IM, but it can be given IV if it's a dire emergency and you need to reverse the xylazine. Yeah,
Okay, I think that's all. Thank you.
thank you.
Good morning, Miss. My name is Bilyadi Zul. I am a student of internship and co-assistant of IPB University. So my question is there any consequences or example consequences if we don't use pre-medication before doing prolonged surgery?
Before doing prolonged surgery.
Prolonged
yeah.
like bone surgery,
Okay.
etc. Thank you.
That's a great question. So pre-medication is really common where in the practices that I've worked in, and acepromazine has a very long duration of action. It lasts about 6 hours. So usually it has positive effects into the recovery period as well. So, and even for a long surgery, everyone's definition of long varies. You know, long for something that's really boring isn't very long in time, but long for something that's exciting takes more time. But prolonged maybe for a few hours, is that what you mean by prolonged? So if you've used acepromazine in your pre-medication, that will help with the recovery procedure. And really that it helps their anxiety and how relaxed they are before and after, but it also is an opportunity to give some analgesia beforehand, and that will really help their recovery because they're likely to be more comfortable and less painful when it comes to the recovery phase. So pre-medication is really useful. Even if you're using xylazine and ketamine and an injectable anaesthetic, you can still pre-medicate with acepromazine on its own or with an opioid if you have access to those drugs, or on its own is also fine. So it's just, when you give it to a dog or a cat, you don't see them really obviously sedated. They're just a little bit calmer, and it will drop the dose of other drugs that you need to give, which will help with their recovery. So there's lots of good reasons to give a pre-medication. Is that something, do you have access to acepromazine here? Do you use that drug, or?
We usually use atropine sulfate before doing surgery with ketamine and silazine.
Atropine, yeah. So atropine's used to keep the heart rate high, but it doesn't have any sedative effects or any analgesic effects. But it's commonly used as a pre-med to keep the heart rate up. I actually don't like giving atropine with xylazine because the way that xylazine works on the heart and the blood vessels means that when you give atropine, you're more likely to have some complications. So I usually don't give atropine if I'm using a drug like xylazine. But it is useful to keep the heart rate high. And it also dries up secretions in the lungs and the airway. So that can be useful if there's a lot of saliva. It's, you know, in some breeds, they salivate a lot. So it can be helpful for that reason. But generally, I don't use atropine as a pre-med if I'm using xylazine because I'm worried about the impact on the heart. For a really healthy animal with a healthy heart, it's probably okay, but sometimes you're not really too sure, so yeah. But atropine doesn't cause any sedation, it won't drop the dose of other drugs, and it's not an analgesic either.
Thank you so much.
That's a good question, thank you.
We are going to have the last question. So,
thank you. My name is David and I'm from COA student. My question is, as we know, there's a risk of the animal having allergy or bad reaction of anesthesia. Is there any way to prevent or minimize the risk before we giving them the anesthesia? Thank you.
Okay, so the question is about allergic reactions to anesthesia, yeah, and how do you prevent that? That's really hard. With people, you can ask them if they have allergies, but with animals, you can't. So all you can do, I mean, allergies to anesthetic drugs are quite rare. Allergies to antibiotics are quite common, and also to non-steroidal anti-inflammatory drugs like meloxicam, but to xylazine and ketamine and isoflurane, allergies are actually very rare. So you can feel comfortable that it's not a common problem. But if you're monitoring the animal very carefully, and after you give a drug, you see the problem that you think might be an allergy, if you're monitoring carefully, then you can jump in and manage it. The best thing to do if that happens is to stop giving the drug. So stop delivering it, stop injecting it, or if it's isoflurane, stop delivering it. And the signs of an allergy, an allergic reaction during anaesthesia that are really dangerous are related to constriction of the bronchi in the lungs, and that's very dangerous. So that causes bronchoconstriction. And if you think that that's happening, then you can give a drug to bronchodilate if you have it nearby. There's probably not much to gain from giving an antihistamine right there and then because it's too late, but you could also give a steroid like dexamethasone to treat the allergy. But so first of all, allergies to anaesthetic drugs are actually quite rare. It's much more common for antibiotics and non-steroidal anti-inflammatories, are painkillers. And if it happens, the dangerous sign will be bronchoconstriction, and you could treat that with something to bronchodilate, like terbutaline or Ventolin, like people use for asthma, and perhaps some dexamethasone or a steroid. It's earlier signs of an allergy, if they're just starting, and it's hard with animals because they've got hair all over them, but they might start to go a bit red and blotchy, and it can be helpful to look at their ears, inside their ear, because that's where you can see the skin the best, or their tummy maybe. If they were awake, they'd be itchy, but they're unconscious, so you won't see that. And their gums might change colour and go redder because there'll be vasodilation with the bronchoconstriction. Their heart rate may go up as well. So if you start seeing those things, you could start thinking maybe there's a problem and there's a reaction to the drug, but reactions like that are actually very rare to anaesthetic drugs. So it's maybe something else that's going on.
All right, so we actually still have some time left, so we are going to have one last question.
Okay, thank you so much, Akila, for the opportunity. Good morning, doctor. My name is Risa, and thank you so much for your amazing presentation. What I want to ask is maybe it's kind of related to the last questions. So it's about, I was once saw surgery that when the cat is injected by the anesthesia and it stopped breathing for a while. What I want to ask is it about allergic to the drugs or about anything else, and what shall we do if we face that situation where the patient is stopped breathing after we injected the anesthesia?
Okay.
Thank you.
So you've seen this happen in a cat? You saw this happen in a cat?
Yeah, it's happened to the cat.
And can you remember the drugs that were given?
It's ketamine and selazine.
Sorry?
Ketamine and selazine.
Okay. Yeah. So post-induction apnea is not uncommon with a lot of drugs. So as the drugs hit the brain, if they've got there really quickly, then the brain tells the lungs to stop breathing. So post-induction apnea, if that's what happened, is quite common, and you treat it by manually ventilating the animal. So if you need to have an ET tube in place, and you need to have a way to deliver a breath, so a bag on the breathing system or a bag separately, it's called an ambu bag, so that isn't part of a breathing system, it's just a bag on its own. Have you seen, they're often part of an emergency kit. But that post-induction apnea, it's important not to panic and go, oh no, they're not breathing, what's happening? It's important to breathe for them, so depending on how big they are will determine how often you breathe and how big the breath is. And then whilst that's happening, listen to their heart and look at them and make sure they haven't got way too deep, that you haven't overdosed the anaesthetic. If you have overdosed, then you need to try and manage that. But the best thing in the period is to keep breathing for them, check the other stuff that's going on, and then figure out what you've done. My colleague has a comment as well.
It's a very quick question. I just wanted to ask Dr. Gabby if she could give her views on whether or not you should routinely use endotracheal tubes or not.
Well, my first question is, who does routinely use endotracheal tubes? Who has endotracheal tubes available to use? Are they expensive? They cost a lot? Or so if you were using a lot of xylazine and ketamine, which I understand is common here, then putting an endotracheal tube in, it will help the safety of the anaesthetic. And especially if you have a problem like over here where the animal stops breathing, then it means you can treat that problem very effectively and continue on. So an endotracheal tube is very helpful. In Australia, they're not very expensive, especially compared to the drugs and so on. And like I said before, you can use them again and again. On the packet it says single use, but you can wash them and use them again and again. And if you needed to breathe or ventilate an animal, you have to have a tube in the airway to do that effectively and safely. So if you don't have that there, it's a lot more difficult. Yeah.
Thank you so much for the answer, Doctor.
Thank you.
I'm so sorry, everyone. Unfortunately, that's going to be the last question for the first presentation. Before we get to the next presentation, we have a video from Synthesia Animalia Indonesia to show to all the participants. Please enjoy the video.
dari sananya dikirimnya. Iya kan. Videonya dari mereka soalnya, bukan dari kita. Iya, kalau nggak ada suara dia pasti komplain, kok nggak ada suaranya.
So that's a glimpse of what Synthesia Animalia Indonesia activity. I should say that it is really inspiring. Thank you so much. And you can follow or visit their website to see more about their activity. So we are going to go to the next presentation for Dr. Gabriel Mas. The time is yours.
Okay, so we talked about anaesthesia. Now we're moving on to analgesia, quality of life, and euthanasia. So pain in humans is defined in a very succinct definition published by the International Association for the Study of Pain. So it's defined as an unpleasant sensory and emotional experience associated with actual or potential tissue damage or described in terms of such damage. So pain is really important to understand really carefully. If you want to treat pain, then it helps a lot to understand the definition of pain. So it's unpleasant sensory and emotional experience. They're the two words I want you to remember for this part. In anaesthesia, it was controlled and reversible. In pain, it's sensory and emotional. So pain in animals is no different to pain in humans. We now understand that animals experience pain in the same ways that we do. They just don't. Sorry, with that in mind, if you look at this extended definition of pain in animals, so again, it's considered a sensory and emotional experience, but it demonstrates that there's some awareness of the animal, that there's something that hurts, and that the animal that will therefore start to do things that will protect it from further injury and to help recovery of that injury or that painful part of its body. So there'll be changes in not just behaviour but also physiology, which will ensure that the animal doesn't continue to injure or damage that part of the body that's painful, and that can recover. So I've talked about a couple of definitions, and I think I've reinforced that anaesthesia is controlled and reversible, and that analgesia is a sensory and emotional experience where the patient neither perceives nor recalls noxious stimuli during anaesthesia. Now I just want to get a little bit pedantic, that we talked about the balanced anaesthetic before, including muscle relaxation, unconsciousness, and anti-nociception. When you're unconscious, you can't have an emotional experience because you're unconscious. So pain during anaesthesia doesn't actually happen. What happens during anaesthesia is anti-nociception, which is the sensory component of that definition of pain. But that's important to understand because although the animal can't experience pain or have a feeling about it when it's anaesthetized, what's going on in the body still happens. So when they wake up, if nothing's been done about it, then they'll be more painful than they would be otherwise. So just to reiterate, the sensory component of the definition of pain is called nociception. So that's what's going on within the body, not what's happening in the brain to say, oh, that hurts and that's making me feel bad. And the emotional part is how it makes us feel, or the animal feel. So here's Harry again. He's the black and white dog on the bottom right there. He's had a big day, and his friend Tia on the left there has also had a big day. Now, of those two dogs, who do you think looks more relaxed and comfortable? Do you think it's Tia, the black and tan or the black and brown dog on the left, or Harry, the black and white dog? Who's had a better day? Who thinks it's Tia? She's had a better day? Yeah? And who thinks it's Harry? Oh, okay. So I don't know what you define as a better day, but Tia's had surgery on her knee. She's got a big bandage. She had a cruciate ligament rupture and she's had that repaired. Harry hasn't had anything done today. He just missed his friend and he was upset that she got lots of attention and a big bandage, and he's annoyed that he wasn't the centre of attention, or he's worried that something's different and he's not sure what to worry about. So he's not in any pain at all. He's fine. We put the bandage on him to cheer him up, and it did. But Tia's the one that's had surgery, but she's had a good surgery and some good pain relief as well. So I've just put this in here because we're going to talk a little bit about pain assessment soon. So just to, it's really difficult when I give you a photo to ask you a question about pain, but it's really important, if that was all you had, to ask about what's happened to those animals that day or before. Okay, so we're going to be talking about analgesia, and part of that is anti-nociception, which relates to anaesthesia as part of that balanced anaesthetic approach. So pain was also first defined in the 1600s, so around the time they started to develop anaesthetics was when they started to understand that pain was a thing and pain hurt and people didn't like pain, and if it could be avoided, then that was better. The first description of pain was in 1644, and this is a French artist who was, although he was an artist, he was very insightful and became a scientist. He described what happens with pain, and he thought there was a wire in the body that from the pain, where the painful thing happened, so where there was some damage to the tissue because you stuck your big toe in the fire or whatever had happened, that a wire went up through the body to the brain to say there's a problem and I'm going to do something about it. I'm going to take my foot out of the fire, or I'm going to be careful to not enable any further injury or pain. So he wasn't too far wrong. He wasn't quite right, but given that he was alive in the 1600s, I think we know a lot more now than he did then. He did get the concept kind of right, in that there's information travelling through the body to the brain where you acknowledge there's a problem. So this is a description of how what we know today and how that relates to his original theory. So in fact there is some injury, so a burn perhaps, that causes peripheral sensitization or activates some inflammatory responses at the site of the injury. Those inflammatory mediators, or those chemicals in the body, start to travel around and go to the spinal cord, where they set up some information processing that then goes to the brain, which is where we go, that hurts on my big toe where I stuck it into the fire. So we're not going to delve too much into the really nitty-gritty of pain because it's really complicated sometimes, but I want you to understand the basic steps. So it's also a good time to remind us about pain. Now, my experiences with pain will be very different to yours, and if I was to break my arm tomorrow, my feelings about the pain would be very different to yours as well. And they're very different because of the different painful experiences I've had in my past. I'm a woman, men and women are different, and also the culture that That's the signal to slow down. Okay, I'll talk more slowly, sorry. So pain is very individual. My experience will be different to yours, will be different to yours. And dogs and cats and horses and cows are also likely to have different experiences. One of the biggest things that contributes to your experience is previous pain and how well managed that was or not. So previous accidents, previous childbirth, previous whatever will impact upon how you feel pain in the future. So pain's very personal, it's very individual. Every animal and every person will have a slightly different experience. But what's happening on a sensory level will be the same. It'll certainly be the same in mammals. Fish and birds and reptiles are a little bit different, but they still have the same neurophysiological responses to pain. The way that's perceived and the way they manifest, that's a bit different. But we're just going to stick with mammals today. Pain and nociception are different. I think I've explained that. Pain involves the experience. Nociception's just what's happening in the body. So what would happen during anaesthesia, for example. Pain does have a role. It's not all terrible. A little bit of pain is helpful to protect yourself from further injury. That's why it's there. It's an adaptive mechanism, and it will help animals understand when they need to rest their leg so it can get better, for example. So it does have a use, but if it goes on for too long, if it's not properly looked after, then it will set up changes in the body which mean that it could turn into really awful pain for a really long time, and that's not okay. So our approach is to treat any pain, all pain, as soon as we can identify it to ensure that it doesn't progress. So if pain is identified or predicted in an animal, then you should treat it. And the drugs that we use, other than local anaesthetics, won't totally remove all the pain. They'll just diminish it as much as we'd like it to be removed entirely. But it does have a little bit of a positive effect. And just because animals can't tell you how it feels doesn't mean that they're not feeling it, okay? And that's where we've got to get really clever about observing them and understanding their normal behaviours so we can interpret their abnormal behaviours. And we're going to get into that a little bit just now. Okay, so this will be in your exam, okay? This diagram you need to remember because this is really important. I'm joking. Pain's really complicated, and it's important when you read about pain not to get overwhelmed with the complexity of it. Otherwise, it's easy to think it's all too hard. Pain can be simplified, and that's what we're going to do today. So the main steps in the processing of nociception and then the perception or the emotional effect are described here. So there's some damage to the tissue, a burn or a cut or a surgery. That information gets transmitted to the dorsal horn of the spinal cord and then projected to the brain where there'll be perception of the pain. So they're the steps, and then the brain does things and tells you to take your foot out of the fire or tells you to take a aspirin or a Panadol or whatever. Okay, the dogs can't do that, so that's where it's really important that we get involved. So if we can interfere with that pain pathway in as many places as possible, then we can manage pain, okay? And there's lots of steps there, so there's lots of opportunity to interfere with the pain pathway. So here's our friend from earlier, the one that was hit by a tractor and has had to have one leg amputated and has some other injuries. Now, we weren't too sure if he was painful or not, but the picture on the left is when we'd got him out of the cage to try and examine him a bit more carefully and think about how to look after him a bit better. So I think on the left you can see he's not totally relaxed. His eyes look a bit worried and he's not really looking super happy. On the right, he's had some extra care and attention, some extra analgesia, and he's much more relaxed. And that second photo is only an hour or so later. So the point of this is that sometimes it's easy to think, well, I've given some analgesia, I don't need to think about it anymore because the drugs have been given. But it's important to always check that they're having the effect that you want them to have and that the animal's responding as you had hoped. And that's where identifying pain is really important and having a process to assess it and evaluate it and make sure that it's going in the direction that you want it to go in. And you can go around in circles doing that. So if you've identified pain, and then we're going to talk about this, assess pain somehow, then treat the pain somehow, check that the treatment has had the effect you want, and then keep on going for as long as is necessary. So with this dog, it took a good week to keep doing that until he was up and about and really back to normal. After a dog's been spayed or castrated, it might take half a day or not very long, depending on the circumstances. So it's important to keep doing that for as long as it takes to get the animal back to a comfortable state. So pain assessment is really hard. The best way to assess pain in people is to ask them how it feels. So, and the question might be on a scale of 0 to 10, what's your pain today? 0 being no pain at all and 10 being the worst pain imaginable. And you might say it's a 4 or a 6 or a 1 or whatever. That's a common approach in humans, but then it's much more complicated. It may be that it's a throbbing pain or a burning pain or an unrelenting pain, or it keeps me awake, or it only happens when I'm doing this, and it only happens at that time. So animals can't do that. So we have to assess their pain some way or another, and we have to interpret their behaviours and their physiology in order to assess their pain. And that's easier said than done. And it would be really nice if we could have a test to measure pain, but unfortunately that doesn't exist in humans, except humans, well, most humans can talk, but children and non-verbal humans, same sort of strategies are used. And in fact, with animals, we've learnt from humans because not all humans can talk. So there's two kind of main categories of pain assessment tools. The first is objective measures, where you can measure something and give it a number and say its heart rate is 92 and we would expect it should be 60, so that's high, so maybe that suggests pain. The problem with that could be helpful. Other things that could be measured to suggest pain are blood pressure, especially during anaesthesia, to assess nociception. The size of the pupil, if the pupil is dilated, that could suggest pain, but that's a sympathetic response as well, so it could also suggest stress or a fight or flight response. There's a few other things there as well. What I have put in there is the facial grimace, and we'll talk a little bit animals in pain and know that it grows down when we give them pain treatment, and away we go. But we're not there yet. We're not even there in humans, but we do have that self-reporting part in humans, which makes it a bit easier. So I'm going to focus a little bit on facial expression analysis and also composite behavioural scores. So facial expression analysis has been developed in cats, for two types of cats, for normal domestic short hair, like our friends that have been listening into the lectures today. I hope they're telling all their other cat friends all of the things they've been learning. But also for oriental cats, like Siamese cats, because their faces are very different. So a grimace scale's been developed for those two types of cat, not for dogs yet, but for some other species. And then composite behavioural scales, so composite meaning a few different things, and observations of behaviour. So we'll talk about those two. So facial grimace scales were originally developed in rodents because those animals are used in research, and it became very important to be able to assess their pain, not just to help the research, but to make sure the animals were looked after properly. So the first two species that this was developed in were mice and rats. And you can see that the focus is on the shape of the eyes, the position of the ears, the bulging of the cheek, the flaring of the nose. So a similar theme has been applied to different species. So this is the mouse grimace scale. This is the rat grimace scale. Then one has been also developed for horses, also rabbits and sheep and pigs, and also cattle. So a lot of different species have been studied to develop those grimace scales, but they all very much rely upon looking at those things that I mentioned before. So the shape of the eyes, the position of the ear, the shape of the cheeks and the nose, and the whiskers, if they have whiskers. And these have been really helpful, and they rely upon our natural instinct to look at somebody's face when we're wondering how they're feeling. And we do that with animals just intuitively. It's one of the first things we do, and we can get a lot of information from looking at a face. Some of these scales are quite complicated, and there's little videos or cameras that capture the image and measure exactly the angles and all of that, and give you a really precise interpretation of the grimace. But not all of them need to be that complicated. Just looking at the face and then spending enough time to ensure that your observations aren't just a little snippet, but actually will be a Bali dog or a mix of a Bali dog. So they may be a good breed to develop a grimace scale in, but with dogs it's all too hard at the moment. There's not been enough time spent in a breed-specific facial grimace scale. Here's Harry. His face looks pretty happy today. He looks like the guy in the cartoon, but not always. So his face gave a lot away. He was a very expressive dog, and I used to look at his face a lot. Okay, so that's facial grimace scales. So something it's really easy to do when you're working with animals is to look at their face and try and therefore interpret how they might be feeling as a result of that observation. On its own, can be dangerous to kind of look at it if you just see it doing something for a second or so. Try and understand what's happened in the lead up to that observation, and that it's a consistent observation. So it's happening for a long enough time. So composite behavioural scales are also a really good way to assess pain, and they take into account a few different parameters. So this is an example from the University of Glasgow, where they did a lot of research into developing a composite scale that could be used in dogs with acute pain, so after surgery, and looking at a few different parameters. So they start by looking at the dog in the cage or from a distance before interacting with the dog and just observing what it's doing, and then start to interact and perhaps try and take it for a walk or feel around the site where surgery was performed. So that combination of observations then creates a score, and then with this tool, the score will determine what you do. So you may then give analgesia if the score is 16 out of 24, for example. So composite behavioural scales can be quite fancy, like this one, but they can also be quite simple, and it's really probably the best way to approach them is to develop one in your clinic or your context for you and the people that you're working with. So having 4 to 6 different observations, so one might be about the face and the expression, one might be about the gait or how the animal's walking, one might be how much it's moving around in general, like is it quite active or is it resting most of the time, one might be about its interest in food and drink, and one might be about if it's putting weight on the leg that it had surgery on, so quite specific for the procedure. So you can develop a scale that fits the environment that you work in. Then you give a score to each of those observations. So did you have a question? No? Okay. So 0 would be it's all normal and it doesn't get any better than that, but a 1 or a 2 or a 3 or a 4 may suggest that there's a change. So generally with these, the higher the score, the worse the situation. Then you get a total score and agree on where to intervene. So these can be contextualized to the environment that you're working in. They're really useful to communicate. If you're having a couple of days off from looking after animals, maybe because it's the weekend, you could say to your colleague, I'm not going to be here tomorrow, but we did surgery on this dog this morning, and before surgery its score was 0, and after surgery its score was 12, and we gave some analgesia and now the score is 8, but I would like it to be lower, and it becomes a way to communicate with each other about the pain of an animal. So it's really useful in that regard. They help monitor progress, so if you give some treatment for pain, then you would expect the score to drop. So that can be really helpful to give you confidence that you're doing the right thing. Okay, but pain, who finds assessing pain in animals really difficult? Yeah, it's hard. I think it's really difficult. And it's really, you bring your own personal experiences to it, and it's really hard to have confidence that you're making the right decision. And there's no different for everybody. I find it hard despite knowing that there's lots of different approaches I can take. I still find it really difficult. And there's a bunch of challenges here and they're listed, but to go through them carefully. So there's a lot of differences between different species and breeds. If you're used to working with dogs, then you get accidentally good at understanding what normal dog behaviour is, and therefore being able to identify abnormal behaviour and how then interpret the significance of that. But if you're a vet that works with dogs and then you go and do some work with cats, they're totally different. Their behaviours are very different. So it's a very species-specific field. If you then had to go and work with a sheep, again, that's just totally different altogether, because sheep are very good at pretending they're not in pain because of the way they've evolved as a species that's preyed upon. So, but even within a species, different breeds of dog and cat behave differently. So a good example of a breed that's really tough and strong in Australia would be like a bull mastiff or something like that. They don't tend to overtly display pain very, very easily, but a little chihuahua or a little whippet or something like that will seem to have a very low threshold for pain. So there's differences even within a species, especially with dogs, who we know very well because they're so domesticated. So if you don't know what's normal for that animal or that breed or that species, then it's really hard to interpret what's abnormal and then what the significance of that abnormality is. So it really helps when you're a vet to work in an environment where they're not likely to be as happy and relaxed like a clinic or a hospital or dealing with a vet. We all come along with ideas about how animals should or shouldn't feel pain, and that's fair enough. So it's important to acknowledge that and then try and get scientific about it and understand how some of the things we've been talking about today and how they can impact upon your interpretation of pain. It differs between individuals, and you can see a few of the comments here in green emphasise the importance of being familiar with normal. Okay, if you're familiar with normal, if you see a lot of normal, it's easier to understand when something's different or abnormal. Okay, and one of the most challenging things I think with assessing pain is anxiety instead of pain. So those pictures of Harry, so figuring out the difference is really helpful. Okay, so there's a couple of nutshells here, a couple of take-home messages. With regards to managing pain as best you can, it really helps if you understand the physiology of pain. And you don't need to know that really complex diagram, but understanding that more basic one is really helpful. Being able to identify and evaluate pain in animals, so a pain assessment will help you treat pain. You have to assess it if you want to treat it. And then understanding pharmacology and other ways to manage pain, like potentially acupuncture or just basic tender loving care, comfortable environment, will all help manage pain. So with those three components all covered, which you'll get in your physiology and your pharmacology and your pathology courses, then you become very well equipped to try and identify and manage pain in animals. So we'll delve into that a little bit more deeply, briefly, to talk about pain management, and we'll talk about preemptive analgesia. We'll talk a little bit about local anaesthesia, which we've touched on a little bit already, and that basic nursing care, which I think I've covered. So you're armed to treat pain. You understand your pharmacology, your physiology, your pathology, you're an animal behaviouralist as well. You've got all of those skills, so now you can treat pain. If you want to do that, the best way to do it is to ensure that it's preemptive. So you're giving the analgesia before the painful thing happens. So I talked a bit about pre-medication before, and that's an opportunity to give analgesia before the painful thing happens. So xylazine and ketamine are useful drugs for anaesthesia, but they both have analgesic effects as well. So when you use those to induce and maintain anaesthesia, you're actually achieving some preemptive analgesia at the same time. So that's really handy. So if you want to make sure that the animal's response to a painful procedure is to be as comfortable as possible, you give the pain relief before the procedure. So if you knew that you were going to fall off your scooter this afternoon, it'd be handy to take some painkillers beforehand, okay? You don't always have that opportunity, but if you're performing an elective surgical procedure, you do have that opportunity and you should take it. So preemptive analgesia is number one strategy to manage pain well. The second is multimodal. So interfering with that pain pathway in as many ways as you possibly can, okay? So using different drugs that act in different ways to interfere as often as you can. So local anesthetics are one of the best ways because they totally block that transmission. Nothing gets to the brain if a local anesthetic has been put in the right place. So local anesthetics can be really helpful to use with your xylazine and ketamine anesthetics because they work in a different way, they don't contribute to the brain depression, and they're very effective. Is lignocaine a drug that you have access to here and can use sometimes? Lignocaine or bupivacaine or lidocaine, it's sometimes called. Lignocaine? Yeah. So the only issue with lignocaine is it's very short acting, it doesn't last very long, but if you can give it preemptively, then its duration of action's not too big a problem. So we're in this multimodal analgesia. We've talked about local anesthetics. Non-steroidals will interfere with the pain pathway in a couple of places. Opioids will in a few more places. Alpha-2 adrenoreceptor agonists. Can someone give me an example of an alpha-2 adrenoreceptor agonist that you guys use regularly? Xylazine? Yeah, so xylazine is one of these types of drugs. So it interferes with the pain pathways in a few places. And ketamine also does, which is another anesthetic drug that's really helpful because of that reason. Ketamine's analgesic effects are really interesting from a pharmacological perspective, if you're into that, but they're not really good for treating pain. Like, I've got something that really hurts, I'll have some ketamine. That's not the way to use ketamine. The way that it works is by slowing down the changes in the body, so it has longer lasting effects. So it's not the best drug to use for acute pain there and then. So you wouldn't give it 4 hours after surgery on its own just for its analgesic effect. You would give it in your anaesthetic knowing that it's going to diminish pain over the coming days. So it works a little bit differently. Okay, and the third part, so analgesia should be preemptive, so given beforehand. It should be multimodal, so using drugs from different classes, and it should be given for long enough. And how long is long enough is really difficult to say, but if you can evaluate pain and assess pain, then you can figure out how long it should be treated for. Okay, so that's pain all done. It's simple as that. I mean, we could talk about pain and pain assessment and the pharmacology and the physiology for days, so I've really just tried to summarise the important aspects of it for you. So we'll get on to quality of life. And some of the strategies we've talked about for pain assessment relate to quality of life as well. And then we'll talk about decision-making processes and some of the practicalities for euthanasia. So assessing quality of life is hard in people. Pain's slightly simpler. Quality of life refers to welfare and that all those factors that contribute to welfare and how an animal or a person, for that matter, copes with not just the environment that they're in, but the day-to-day part of life. So the ways in which to assess quality of life involve a lot more different parameters. So with pain, we talked about perhaps just 4 to 6 different observations. With quality of life, there's a lot more. But you don't need to step it out. This is an example from a university in the United States where they have like 20 different things to look at. But they're worth thinking about and having in your mind when you're trying to discuss with an owner or an animal and trying to make a decision about the best treatment option. So understanding quality of life, which is a reflection of their welfare, will help you determine what's the best thing to do for the animal. So this includes looking at multiple criteria over time. So just a single snapshot on a day will just give you a baseline. You then need to look at it again maybe a week later or a month later or days later, depending on the progress of the condition, to determine how it's going. So it must be done over a period of time. It helps to be familiar with the animal, the individual animal, how old is it, what sort of breed is it, and has it got other problems as well, has it, other than the one that it's come to see you for today. So if you had a 15-year-old Bali dog, I don't know how long Bali dogs live for, 15 would be pretty old, I think, and it had 3 different problems, then that's a lot of information already about its potential for getting better, but also its quality of life. So this is an example of another way in which quality of life can be assessed. This was again from the University of Glasgow. It's quite complicated, but I'll show you some of the results from that for my dog Harry in a moment. So here we are. So when Harry was about 12, I started to get worried about him because he didn't seem to be his usual self. He wasn't enjoying the beach in quite the same way, and I thought things not quite right. So I had the opportunity to use that quality of life score from the University of Glasgow, and I looked at different things over a period of time, over a few months. And you can see there that the green, red, and black parts of the graph, which show pain, distress, and anxiety, is dropping over those first couple of months. So my hunch was right. Something was wrong and it was progressing, and his quality of life was changing, and probably for the worse. So when I got to that point and convinced myself that he could have a better quality of life, I started treating him for what I thought was arthritis, which is painful. And a week after that treatment started, the graph shifts. So his vitality increased and his pain and distress and anxiety decreased. So that's where it was really helpful, and I'm a scientist, so it helped me to have some data to convince myself that that was something needed to be treated and that the treatment was working. But as a vet, that's what we're all about, so that's really, really helpful to try and do for the animals that you're looking after, or for other people, or for your own animals. So that's where the reason we're talking about this now is to think about it when euthanasia may be one of the treatment options that you've got on your list. So euthanasia is a really difficult situation to navigate. It's really hard, even for vets who know more about animals and all aspects of animal care than most other people do. It's still really challenging. And by definition, euthanasia is a humane death. It's for the benefit of the animal, and it will relieve suffering. It's an obligation that we have. We went through the oaths beforehand, that we're all obligated, wherever we are working in the world, to ensure that we optimise the health and welfare of the animal, and that we manage their suffering if we can. And as people looking after animals, euthanasia may be one of those treatment options that we seriously need to consider.